Good morning, good afternoon, good evening, everyone. It's an honor to be here today to present this Leadership Summit, Pharmacy-Based Vaccination Policy and Advocacy, organized by the International Pharmaceutical Federation. I'd like to inform you that we have more than 850 registrants so far, and we know by experience that some of them will join us during this session. But anyway, welcome to this summit. We will start now with some announcements. As usual, the webinar is being recorded and live streamed on via YouTube. The recording will also be available on the website of the FIP on the events area. And you can also, you are also allowed to send or given the opportunity to send some questions using the question box provided. And if you have any ideas or any feedback, feel free to send it to webinars@fip.org. And it's always a good opportunity, if that's not the case, to motivate you to become a member of FIP. And here you have the links where you can actually get registered. And now it's time to present a little bit or show or to give some information about myself. My name is Luis Lourenço. I'm first and foremost a community pharmacist, and I've been since October this year the professional secretary of FIP. And I have with me Linda Bader, who is actually the FIP lead for Workforce Transformation and Development. We will have the privilege to have Lina leading the summit. I would like to give a huge thank you not only to Lina, but also to all the FIP secretariats for all the work done that led us to today's summit. Moving forward with the presentation, we have the aims for our meeting today. They are very much self-explanatory. Recap the primary outcomes of the Transformation Vaccination Program, launch and adopt the commitment to action and sustainable and equitable access to vaccines through pharmacy, discuss some regional priorities, hear from global leaders from health and pharmacy on how we can reduce inequities, and also carve the pathway to implement the commitment and integrating pharmacy-based vaccination within life course immunizations. Now, it's always a good opportunity because we know that we have non-members with us today, just to share some information about FIP. So before we delve into these aims, some background about FIP, which I'm sure most of you are familiar with. It's always good to remember. So FIP's mission is a world where everyone benefits from access to safe and effective medicines and pharmaceutical care. And then, of course, we also have a mission, and that'll show up in a minute also on the screen, that is improve global health by supporting the advancement of pharmaceutical practice, science, and education. In the next slide, you will see that, well, our CEO, Dr. Catherine Duggan, together with the Director General of WHO, FIP is committed to supporting the world achieving the United Nations Sustainable Development Goals, with a particular focus on the world goals, or focus on the health Sustainable Development Goals, sorry. More tactically, we reinforce our collaboration with partners over the past 12 months. During the World Health Assembly in Geneva, we signed a memorandum of understanding with the WHO to support their initiatives in human resources for health, primary health care, and universal health coverage. There's also an important information I'd like to share with you. That's the One FIP perspective, or One FIP goals. So having a set of the One FIP development goals enables us, FIP pharmacists, practitioners, pharmaceutical scientists, educators, to identify commonalities across all areas of FIP, as well as some unique attributes to each area. We believe it is imperative to bring science, practice, and workforce and education together into one transformative framework for our members and the wider profession to clearly set out the goals for development for the next decade. FIP believes that we can have no pharmaceutical care without the pharmaceutical workforce, and we can have no pharmaceutical care without the scientific foundation for the next decade. So that's all from my part. I would like to hand over the presentation to Lina. Thank you so much for your attention. We're looking forward to hear from you. Lina, the floor is yours.
Thank you very much, Louise, for that lovely introduction and some context and background on FIP. And of course, we are relying on the fact on the participants being with us today. This isn't their first event with FIP, but if it is, then this is going to be a good opportunity for you to know a little bit more about what we do. And I'm really pleased to be co-chairing today's summit. It's the capstone event of this year-long program, which is coming to an end. So a bittersweet moment, but I'm really grateful to be here alongside the Transforming Vaccination team, who you'll get to meet and hear from shortly. Let's begin a little bit. We'll do some context, and we have planned some engagement activity for our participants today here with us. So we'd really rely on your engagement and interaction with us. Pharmacy-based vaccination and vaccine-related services, we have realized that are linked to 17 of the 21 development goals, which Louise has introduced to you. We find that the vaccination has a central role in about 7 of them. That includes Development Goal 10, equity in access to vaccination services across all ages. And of course, that's one of the core concepts of this year's Transforming Vaccination. Development Goal 11, impact and outcomes, and not only in terms of disease burden and healthy living, but also economic outcomes, education, and social gains. Development Goal 15, people-centered care, namely by providing more convenient and accessible vaccination services in the community. Goal 16, obviously, communicable diseases, the most overtly linked one, of course, but let's not forget how vaccination is so central for the management of non-communicable diseases as well. And we'll hear from our colleague Gonzalo later today about all of this. Development Goal 17, also antimicrobial stewardship. Vaccines are absolutely central in strategies to curb antimicrobial resistance. Goal 18, access to medicines, devices, and services, of course, includes access to vaccination and patient safety, which is such an important element in vaccine development and delivery, as we're seeing now in the clinical research and delivery of COVID vaccines. And of course, grayed out here is Goal 21, sustainability in pharmacy, another really central goal in the agenda of vaccination. So before we begin, we just wanted to ask you a question. Do pharmacists provide vaccination services in your country where you are from? We'd really love to hear from you. A poll will be showing up to your screen, and we'd like to hear the answers. We'll give you a few seconds to let us know. The results of the poll should shortly show to everyone. There we go. We have 58% yes, 42% no, so that's about half and half. And I think I'm going to call upon my colleague Gonzalo later to maybe comment on how these results to compare to the data we already have from around the world. We obviously very much acknowledge and are aware of the variation in this kind of service. So, but we'll hear more about that. Thank you so much for your participation. We'll move on and be prepared for some more questions later on. Later on, we'll obviously recap the program from this year and also give you a very brief summary of last year's program because they are linked. But first, we just wanted to look at the bigger picture here and remind ourselves of where we fit in the world's vaccination services. This video is from the United Nations when they launched, alongside the WHO, when they launched the strategy to achieve vaccine equity globally. Let's watch.
More than 6.4 billion vaccine doses have now been administered globally, and almost 1/3 of the world's population is fully vaccinated against COVID-19. But those numbers mask a horrifying inequity.
Instead of global coordinated action to get vaccine where they are needed most, we have seen vaccine hoarding, vaccine nationalism, and vaccine diplomacy. Not to have equitable distribution of vaccines is not only a question of being immoral, it is also a question of being stupid, condemning the world to millions more deaths and prolonging an economic slowdown that would cost trillions of dollars. That is why I am very pleased to join Dr. Tedros today to launch the global COVID-19 vaccination strategy. This is a costed, coordinated, and credible path out of COVID-19 pandemic for everyone, everywhere.
High and upper middle income countries have used 75% of all vaccines produced so far.
With vaccine production now at nearly 1.5 billion doses per month, we can reach 40% of people in all countries by year's end, if we can mobilize some $8 billion to ensure that distribution is equitable.
The development and approval of vaccines in record time took us to the summit of scientific achievement. Now we stand on the precipice of failure if we don't make the benefits of science available to all people in all countries right now. More than
Powerful words from world leaders and alarming realities. And of course, we're here today because we believe that pharmacy and pharmacists have a role in closing the inequities gap. And COVID-19 only highlights the issues of vaccine inequity and the danger of that. But of course, vaccine inequity matters for all vaccination across the life course. Equity and equality in practice has, since COVID, became an even stronger imperative for FIP because of the pandemic. We must not forget the global imperatives for equity and equality and the ones masked by the pandemic that make it an even bigger imperative for us to act now. Last year in May, FIP issued a statement of principle on the impact of COVID-19 pandemic on health equity and vulnerable patients and populations. In this statement, FIP and pharmacists across the globe reaffirmed their commitment to serve patients and communities in all settings of practice throughout these challenging times of the pandemic, and to promote equity in health protection and access to care across all people, especially the most vulnerable groups, leaving no one behind. We see issues emerging now around access to services and care, and the role of pharmacy becoming even more critical and essential during these times. And of course, one example of equity in practice is vaccine equity. Earlier this year, we published another statement of principle, this time focusing on accelerating vaccine equity for pharmacy teams on the front line. In this statement, FIP stresses that accelerating vaccine equity to pharmacy teams on the front line contributes to widening access to vaccines for all. FIP and the workforce across the globe reaffirmed their commitment to widening access to pharmaceutical services, particularly vaccination-related services, to ensure vaccine equity for all and leaving no one behind yet again. We'll hear more about FIP's work and resources we have developed and continue to develop to support our members worldwide. But another quick reminder of another commitment to action FIP has published last year as part of the Transforming Vaccination Program 2020, our commitment to action on improving vaccination coverage through pharmacies. This commitment was launched in December during the first FIP Virtual Global Summit on Transforming Vaccination in Pharmacy. Of course, today we are hosting our second one. And it describes 17 actions, which include the following objectives you see on the screen: addressing hesitancy, striving towards equity, advocating for legislative frameworks, and ensuring health system readiness for mass immunization against current and future pandemics. I'll pause here for now, and we'd like to invite our first guest today, Professor Bettina Borsch. She is the professor at the Institute of Global Health, University of Geneva. She's also the executive director at the World Federation of Public Health Associations. Professor Bettina, welcome.
Welcome. And hello to everyone around the world. Thank you very much for inviting me. I must say that I'm impressed by all what you're doing. And I was not able to see your two series completely, but I went on the internet to see what was going on and tried to see how you did step by step. And I see also that you will have very, very concrete actions. And you will impose them and you will do them. But allow me to do a little step back and get a broader picture, a little bit following there where Tedros from WHO and Antonio Guterres from as UN Secretary just stopped. I asked the question, will equity go further and prosper, and look at it in the case of vaccination? We have all of us now the experience of COVID for months in different parts of the world. It is one virus, but the reactions around the world are very different. And I think that the first thing we need when we want to gain equity is a cohesive society. So if we say cohesive society, can I action myself? Yeah, I can. When we say cohesive society, we mean a society that forms a unit by facts or by actions. During COVID, were we in cohesive societies? I would like to just cite a study that has been done in Germany during the year 2020 by the Bertelsmann Foundation. They looked at the fabric of society, and they said at the end that the society is at risk to lose cohesion. They first saw a lot of positive reactions in the first wave. People were solidary, people were wishing to help when the first confinement strategies, lockdown strategies were there. But during the year 2020, people lost trust. People started to have concerns about the future. And the most important thing out of this study was that parts of society, especially the less well-off, the lower income people, the people in precarious situations, felt that there is no societal cohesion. And these were then also people who were no longer willing to follow any public health measures such as mask wearing, physical distancing, or now vaccination. And I think this is important for all of us because we need to live together to come to equity, and we have to know how we live together. Let me be a little bit patriot. I'm from Geneva and cite Jean-Jacques Rousseau, who in this city published years ago Le Contrat Social, a book on the social contract, where he explains why we live together and how we live together. And he is of the opinion that free people decide to come together because they see the benefits of being equally cohesive together. This old concept of a social contract, interestingly now, comes back and back again. Different places like the World Economic Forum or the international unions of workers all talk about a new social contract. And I'll show you here the work of Minouche Shafiq. I don't know if you know her. She is an economist. She has been working at public level, but also as academic, and she is now 2017 appointed the director of the London School of Economics. And in her recent book called What We Owe Each Other, she also asked for a new social contract. And one of the important chapters in her book for sure is about health, because people, if you do any questionnaire, they always have health as very high ranking. And that is why cohesive societies in general, always decide to provide health care to their populations. Now, the times from Jean-Jacques Rousseau have changed. He lived in a, let's say, smaller world. We are now a global world. We are not only a global world, but we are also a world where women take part, because at Rousseau's time, 50% of the humanity was not really visible or taking part. In some parts of the world, it's still the case, and we have to work on that too. But as we are globally active living, we need have a global cohesion. If we think of a new social contract, it has to be a global one, because not only the pandemic of COVID, the health crisis, but also the other crises will only be solved if we are on a global cohesive level, because we know, if we think, that we are in it all together. And we have seen that mistakes in a healthcare system far away from ours will influence our well-being or health. But in the same time where we think this way, because what I heard from your vision and mission, it's what we all share. We want people live a healthy life, a lot of us. There are also diversive forces. They are on the political level, and we have them seen very clearly. Multilateralism, the UN, the WHO have been challenged very much during the crisis and still are. But there are also diversive forces in political level where politicians use the health crisis to divide their population, to get benefits for themselves and whatever topics they have. We also see divisive forces inside healthcare systems, where due to the system, people want to separate the doctors from the nurses and the nurses from the pharmacists. And I think you know what I'm talking about. So how can we overcome this? I think we have one value in addition to the fact that we all want health for populations, that is solidarity. And these values, especially solidarity, is an intellectual, political choice that we are doing if we want to have equal, healthy societies. And solidarity is the fact that even if we are very different here around the world, and I was happy to see where people are linking in from all over the world, hello, we are, if we think of solidarity, able to say we unite across our differences, across our professions, across our sectors and our cultures, because we have a common interest, and we will not allow others to divide us and in this way conquer us. But solidarity has to be learned and transmitted. It's not something that falls up on you because you're such a beautiful, good person. No. You have to learn it and relearn it every generation. And I think you should even learn it at school. But I was asked to talk about pharmacies and vaccination. So pharmacy and vaccination have already played, I think, an important role, as we have seen with the questionnaire that we did at the beginning, and a lot of countries. In this case of vaccination and the question equal access, we do see two different opposing reactions. The first reaction in the crisis, especially COVID, was a simple me first. Let me get this first. I want to be the first one to get a vaccine. My country first, America first, you know this. But as I told you from the Bertelsmann study, there was also the other thing, that a lot of people were solidary and tried to help others, tried to help neighbors. So both happened. And the results now are as what we know. On one hand, we have stockpiling. You know that it was very famous in some countries around the world that at the beginning of the crisis, toilet paper seemed to be the one thing that everybody needed. And people even battled around toilet paper and disinfectant. But then comes, after this reaction, all for me, the intellectual thinking. Even if I bought up all the disinfectants, the last 27 in the drugstore, I will not be safe, because if my neighbor has nothing and he touches the elevator or something, I can get infected too. But this is an intellectual process that we have to do, and it's difficult. I'll show you one of these very old pictures depicting it. It's unfortunately in German, let me say. The guy up there says, happily, the whole is not on our side. And I may tell you that in European countries, when we heard in January, February, that there's a virus in Wuhan, I'm sure a lot of Europeans said, happily, it's in China, not with us. And then we had to learn at the very hard way that this concerns us all, that we are all in it together, and that, as Tedros always says, no one is safe until we are all safe. And we know it. We know it. What is hindering us? We don't do the step, the intellectual step that Antonio Guterres named stupidity. It's stupidity if you think of the boat. Stupid, these people. But what hinders us to be solidary, to distribute vaccines all over the world? Well, one thing I think, and that is very well also thought about in the book of Minouche Shafik, we do have to think about our economical systems in general around the world, but also in countries, because the economical system clearly influences the healthcare system and puts people against. It's competing out the other, but this doesn't help. So we have to find new ways to be able to become solidary. And I think that also some political systems, and we have seen the differences around the world, it was mainly the political governance that decided how populations went through the crisis. And there is something to be thought too. And we have absolutely no choice, I think, to support our multilateral system. There is no way of saying, okay, we will create another WHO, we will create another what's going on now. You know that November we will meet here in Geneva for a special WHO session talking about the possibility of a pandemic treaty. A lot of countries are behind this project. And again, there are forces that say, okay, we will do our way. I don't think that we have still a choice for that. Now, in healthcare systems, I said there are also diverse forces. And if we look at the role of pharmacists, and I'll allow myself, I'm a public health person, I look at it, the whole healthcare system, the health system in countries. My research concerns comparing healthcare system. If we put the health system of a country as a flow chart, we can visualize also the mistakes, the flaws. So is this flow chart really flowing in all countries? And where are the pharmacists? I can tell you that in some countries, the pharmacist is a little bit sidelined, or he is seeing himself in a dead end cul-de-sac kind of position. He should be fully integrated. And he should be really part of an equal team of people. Because only like this will we be able to get health to population. And pharmacists, I would like to not to take too much up of my time, but if they are part of it, they have so many possibilities. Here in Geneva, we have once created a course for pharmacists called Community Pharmacists. I mean, they have a shop, people come, they have the link to the community. It's already there. We don't need to create a new center, community center. In some places, the pharmacists can be the community center. In other places, in other countries where I went, you use the temple to be the community center. But look at each of your places and see what is the best role and broader role in the system of the pharmacist. And then we will be able to find the solutions. I think, and I would like to conclude with it, that it's time for us to change paradigm. Our new paradigm should be to think of health as a human right, as a justice issue, and not as a charity thing. We will give something to the poor. That is absolutely unacceptable. It is a right, a human right. And the second, I think, is we should not just work on a symptom. Something is not going here, we will adjust. No, we have to do system thinking, work on the system, and create novel interactions. If in your country you see the position of pharmacy is not what it could be far better, then create novel interactions, work on the system. And the last point, I think, we have been doing a lot of technological fix, and especially the techno-biotech part of medicine believes that there might be a little quick fix, but there are no quick technocratic fixes. We have to consider the political context and also take political action in the broadest sense. With this being said, I would like to thank you for listening and giving you a little bit of fresh snow from the Swiss Alps. Thank you very much. This was my last climb last year on the Monte Rosa in Zermatt, Switzerland. Thank you so much.
Thank you very much for that, Bettina, and for that last visual where I really think we all would love to be there at the moment. But I have a lot to say about your presentation, and honestly, it was fantastic to hear. But I'm going to call upon Luis as FIP's professional secretary. I think I'd like to invite you, Luis, to share some immediate reflections on what you've heard from Bettina, please.
Thank you, Lina. Thank you, Bettina, as well for sharing your presentation. And there's something that really strikes from what you have said, and it has to do with solidarity, because it's interesting because it's also the ethos of our president, trust, solidarity, and action. So I think it's something I need to take care. We need to take into consideration, and it's interesting because when we speak about public health, we just realize that there's a lot that you can do, this idea of solidarity, and we have more points in common than different. And there was another point I actually found it very interesting, that was this idea of the pharmacist, the link with the community, in a way that the pharmacist can be the community center. I think that most of if not all, community pharmacists have that feeling, and it's very good to know that from your perspective and from the International Regulatory Agency perspective, there's actually this link, which is an asset for us pharmacists, and can be, in a way, it has a lot of potential, especially not only in this area specifically, but with others. So that will be my comment. Thank you so much.
Thank you very much, Luis. And thank you very much, Bettina. We'll have another chat with you during the panelists roundtable. And I'd like to encourage everyone to continue submitting their questions through the Q&A box and in the chat with your comments. And we will be picking them up, and some of our speakers will be answering them directly to you. We'll move on as time is racing by to the next bit. We wanted to just use a couple of minutes to look back at Transforming Vaccination Program 2020. So for those of you who don't know, Transforming Vaccination Program started in 2020, and this year's 2021 program is the second sort of follow-up version of that, and they're both linked. We have built up on the outcomes of the first one to really refine and outline the scope of this year's program, which focuses on equity, access, and sustainability. So very quick overview. At the time, that Transforming Vaccination Program of 2020 was the first FIP digital transformation outcome-based online program. It was entirely underpinned by all of the FIP development goals, and it resulted in two key outcomes. One was the FIP Commitment to Action on Vaccination in Pharmacies, which I've described earlier today, and we have also published a FIP Transforming Vaccination Collection. This is a digital collection that summarizes all of the outcomes of 2020 program. So if you'd like a very easy and quick overview of the program, if you haven't participated, we'd invite you to go to our resource page, transformingvaccination.fip.org, and you can browse all of our archive of the 2020 program as well as this year's program. Before we move on, another quick question, and this feels like a test, but we'd really like to know if any of you were participated in any of the events from the 2020 program. So that's last year's program. So another poll will show on your screen. We'd appreciate you letting us know. A few seconds for that, and the results will show on screen. That's about 50-50, which is really great. So thank you for those who have been participating in that year and are with us this year. And thank you for those joining the Transforming Vaccination Program this year. This will be really helpful because later we'd like to hear more from you on how we can develop an action plan for FIP moving forward. So please hold your horses because we'd really, really want your input for that. And for those who have some background on TV last year, I think some of that participation will maybe inform their answers. And we'd like a fresh look of those joining us recently. Moving on to this year's program. So again, today is the capstone event, the final summit of the program this year, which focused on equity, sustainability, and access. Here's a quick timeline of how all of this fits. So September 2020, we launched the first Transforming Vaccination Program. The commitment followed in December, so that was an actual 3-month long program. We delivered 24 events as well, and the collection followed in February 2021. We began this year's program in June. Here we are today launching the summit and the commitment, and we're expecting the collection also to publish in February next year. This year, we hosted 12 events that ran across 2 series. Series 1 focused very high level on equity in vaccinations globally through a number of topics we'll go through today. Series 2 looked at sustainability in vaccinations on a more regional level. And again, we'll hear from our regional leaders today on some of the outcomes of these events. So the first series comprised 5 episodes, which include the opening event of the program, alongside 4 other events that focus on age and life course vaccination, vaccination and the genders, health literacy and education, as well as collaboration and working together. The second of the 2 series comprised 7 digital events covering all 6 regions, and we did run the Americas region twice in 2 different languages to cater for the English and the Spanish-speaking countries. So that's 7 events covering all 6 regions, and we'll hear from our participants, from those, they will let us know what came out of these events and how it will inform future plans. So a recap of key outcomes. And of course, today we're launching another commitment, which we'll share with you, and the special policy collection coming out February 2022. So to recap series 1 in a little bit more detail, I'm going to be inviting my colleague Noor Al-Tahla, is the program coordinator of the Transforming Vaccination Program at FIP. She holds a bachelor degree in medical technology from the University of Jordan, and she previously worked as an IVF lab technologist at an infertility clinic. After that, she went on to pursue masters in healthcare management and is now working with us at FIP. Noor, thank you so much for all of your work in delivering this program, and thank you in advance for giving us a summary of Series 1.
Thank you very much, Lina, for that introduction. Hello, everyone, and thank you for joining us live today. So to recap Series 1, I'd like to go through each of the 5 events we hosted. So in episode 1, which was the opening event of the Transforming Vaccination 2021 program, we looked back at the 2020 program and recapped its key outcomes mentioned to you before by my colleague Lina. We also looked at the emerging issues in the past 2 years, such as the inequities in communities across age, gender, comorbidities, income levels, and other factors, the increased burden on our health workforce, as well as the issues around the shortages and access to vaccines across the globe. We later asked our speakers from different parts of the world to speak about regional and global needs and priorities. We had G. Somalatha from the Southeast Asian region, Prosper Hayek from the African region, John Jackson from the Western Pacific region, and Nadia Al-Mazroui from the Eastern Mediterranean region. Each of them shared their reflections and key outcomes from the 2020 program. Next slide, please. So in episode 2, Equity, Access, and Sustainability Through Life's Ages and Stages, Enabling a Life Course Approach to Vaccination, we held an interview with Jane Barrett, the Secretary General of the International Federation on Aging, in which we dive deeper into life course vaccination. We also conducted 2 interviews as bonus features for this episode one with Louis Priver-Dump from Johns Hopkins Bloomberg School of Public Health, and the other with Daphne Holt, the chair of the Coalition of Life Course Immunization. We're pleased today that we have two of these guests joining us live at the summit, but before we hear from them, we'd like to play a short video from WHO Europe introducing the life course approach to health, which was the main topic of the second episode. Next slide.
The life course approach to public health means matching policies to the needs of people at different stages of their lives. Human life has its own seasons of growth and decline. Each season, each transition, an opportunity to gain or lose health. From the beginning, a child that is cared for, stimulated, appropriately fed and protected, grows into an adult who has greater life chances, better brain development, superior educational achievement, and greater productivity. In adolescence, people gain greater control over their choices, and with the right support, many get a chance for a new start in life. And so on with every transition. The choice of a life companion, parenthood, retirement. Each is an opportunity for promoting and protecting health. No life is lived alone, and all human lives are connected to others in the family, community, or nation. Acting together across government makes it possible to create the best conditions to generate health and well-being through the life course, and to have an effect on the health of generations to come. The life course approach envisions a future where all Europeans grow and age in health and dignity. Let us create that future.
Now, I'd like to hand over to Jane, whom we have the pleasure to have with us today, to tell us more about the key and outcomes of the interview. Jane, the floor is yours.
And thank you very much. Good morning, good afternoon, and good evening. It's such an honour and a privilege to be with you today at the Leadership Summit on pharmacy-based vaccination policy and advocacy, and to speak a little bit more about the whole area of life course approach to immunisation. I think it's important to start off with what I know. Older people and those with underlying health conditions are faced with the most significant risks from COVID-19. Yet we must also remember that they're neither invisible nor powerless. The coronavirus pandemic has breathed oxygen into the space of both tragedy and opportunity. CSOs such as FIP and IFA and many others around the world have worked together across sectors and across disciplines in this very difficult time. In doing so, we are and we have become the glue of solidarity, globally, nationally, locally, and also at a country level. Pharmacies and all who work in this environment have enhanced their profile as trusted sources of information, wise counsel, and even giving us a sense of the normal. Each of you and your colleagues have endured long hours, changing work conditions, and sometimes unrealistic expectations from governments, as well as someone like me, a consumer. A life course approach to ageing and immunisation have intersecting paradigms that pharmacists see in everyday life, and sometimes you serve generations of people, from babies all the way through to that person dying. And other times you guide and you advise. Transformation, which has been at the heart of this series, is defined as a thorough or dramatic change in form or appearance. And we have seen and felt that and almost touched that. It's also a landscape that has undergone a radical transformation. It's a dynamic process. This is just the beginning of our conversations and actions, and now is not the time to relax. In fact, we have to somehow conserve and reserve our energy for the next part. At the heart of a life course approach to immunisation is equity. And it basically does not exist in our community. And indeed, people are being left behind just as we speak. Underpinning efforts to reduce inequity must be sustained societal and systemic change that respect the social determinants of health, and that includes age, gender, education, socioeconomic status, just to mention a few. Improved infrastructure through new investments in health promotion and prevention are at the heart of change, changing our healthcare system from a curative model to a preventive model. Sharing innovation in improved access, taking the vaccines to people. Within the decade of healthy ageing, it is vital that FIP views immunisation through the lens of the 4 action areas: primary integrated care, ageism, age-friendly environments, and long-term care, but also using the enablers of the decade, as you so aptly have done across this series: voice and engagement, capacity building, leadership, and of course, data, disaggregated data. And this will help drive change with and on behalf of current and future generations of older people. And coming to the closing of my remarks, I go back to equity, access, and sustainability of vaccinations through policy and development and implementation is the spine of your work and mine in our organisational transformation. It's necessary now and in the future. Population ageing, which is at the heart of who I am and what I stand for, is a powerful and transforming force that each and every one of you are part of. It's a cross-cutting issue that impacts social, health, and the economic fabric of every single country. It is now critical that we don't stop and praise ourselves for what we've done, but we also use that to inform our future transformations. We have the responsibility in collective leadership to play a pivotal role in reinforcing the need for strategic action across disciplines and sectors, with the common goal of improving the health in the broadest possible sense and well-being of people of all ages. And in doing so, protect their rights during and living and post the impact of this pandemic. And in the words of the United Nations Secretary General, in a world tested to the limit, we must wake up, change course, and unite. Thank you very much, Noor, and all of my colleagues and friends at FIP in Geneva and around the world for creating the opportunity for the International Federation on Ageing to be part of many events across the year, but particularly this one today. So the floor is yours. Thank you, Noor.
Thank you so much for that, Jane. It's always inspiring listening to you speak about the life course approach to health. Next slide, please. I would now like to call Louis Priverdum, who is a Senior Advisor of Policy, Advocacy and Communications and the Director of Adult Immunization at the International Vaccine Access Center at the Johns Hopkins Bloomberg School of Public Health, to tell us more about the key outcomes of her interview. Louis, the floor is yours.
Great. And thank you, Noor, and thank you to FIP for the opportunity to talk about something that's very near and dear to my heart, which is life course vaccination. And I'd love to echo Jane's comments because I think they really resonated, the importance of life course. And the pandemic has really brought to life a greater importance for life course immunization, not just for COVID, but for a multitude of diseases. Many diseases are prevented early in life and can prevent you or can protect you for a lifetime. And vaccination at different stages in life is not just important for protecting oneself, but also for protecting others. As Jane had mentioned, life course vaccination is also an important tool to reduce inequities. And these inequities are often cumulative. Starting in childhood, the impact of disease can carry well through adulthood, and diseases don't impact all of us equally. and they tend to have the worst impact in communities that are already struggling. Some people live too far from a provider or may not be able to afford vaccines or don't trust the health system and therefore seek or delay care, making disease prevention all the more important to reduce disparities. And because some diseases like COVID-19 or the flu can be easily transmitted to others, it's also important to consider indirect protection at various stages of life to protect those around you. Many people in vulnerable communities are living in multi-generational households with older people or pregnant women who may be at higher risk for severe disease, or are working in jobs that increase these chances of getting or transmitting the disease to others. So protecting not just the individual, but those that they come in contact with, including health providers, is important. And we need to educate not just the community, but advocate to policymakers to ensure that vaccine programs are a priority at all ages, not just infancy. But that's easier said than done. Many communities with the greatest needs are also the most hesitant or have difficulty in accessing the vaccine. And data are also important to guide policy and practice. Examining vaccination rates by zip codes or race is important, as is age or life stage. Knowing not just coverage, but where we have gaps can help direct resources to address the disparities that we see. And understanding the factors that make these disparities worse can help in advocacy and policy for equitable vaccination. Data are key to ensure that policymakers are enabling access. Factors such as how far a person needs to travel for vaccine, the hours of a clinic, and who is giving the vaccine matters. The data you gather on who is vaccinated are crucial to evaluating and adjusting any program, as well as advocating for policies that address the disparities in access. And in thinking about acceptance as well as access, we need to consider the factors that influence whether someone will even enter into a conversation about vaccines. Not everyone has conversations with their health provider, and we often hear that people have other concerns. Our communication about vaccines is often most effective when it's context-specific or person-specific. So addressing what is important at a particular life stage can be a very effective way of talking about vaccination. Think about the person concerned about their diabetes, or how that's impacted by a vaccine preventable disease, or the young man that is concerned with healthy and natural living, but not necessarily vaccines. Both of these provide scenarios where integrated education and services provide an opportunity to engage in vaccine conversations and build trust and confidence in vaccines through acknowledging the needs of the individual and providing an opportunity to ask about the situation of others in their families as well. Pharmacists have an opportunity to bring up to those that are designing programs the delivery of vaccines and highlight their role in helping address disparities and complementing the role of public health and the health systems.
Most of us know how important vaccination is for babies and children. But did you know that people can benefit from vaccination throughout their lives? For example, vaccination can protect women and babies during pregnancy. And vaccinating parents can protect newborns until they're old enough for their own vaccines. While vaccines for people with certain jobs can protect both them and the people they work with. It can also protect people with chronic health conditions and older people who may be at higher risk of infectious disease due to a weakened immune system. Vaccination is essential for a healthy life, just like good nutrition and exercise. It protects more than just the individual. High vaccination rates protect communities, stopping diseases being passed on to people who cannot be vaccinated. This is known as herd immunity. It also protects communities by reducing rates of infectious disease and consequently lowers the use of antibiotics. This is essential in fighting antimicrobial resistance. Vaccination throughout life is affordable and one of the most cost-effective public health investments we can make. This means fewer sick days and greater well-being and productivity for our societies. Unfortunately, despite its many benefits, we continue to underinvest. Currently, industrialized countries spend less than 0.1% of their health expenditure on vaccination. There is growing recognition of the importance of vaccination, but we still have a long way to go. We must work together to implement effective vaccination across all phases of life, to safeguard the health of future generations and protect the sustainability of our health systems. Vaccination for all. Leave no one behind.
Right, so moving on to episode 3, vaccinations and the genders, we were reminded by Samiratu of the gap that exists between the workforce and leadership roles occupied by women, in which women occupy over 70% of the workforce and only 25% of leadership roles in healthcare, and how important it is to address this gap. Vaccine inequity must be addressed by including the voices of people of all genders and socioeconomic backgrounds in conversations around vaccine delivery, accessibility, and hesitancy, and through taking into consideration the context and culture in which these policies are placed. Erica Rosser mentions the significance of having gender-responsive pandemic plans that take into consideration men, women, and gender minorities, and highlights the importance of gender-sensitive research and development. Sophia, on the other hand, prioritizes the underestimated role that informal caregivers play in our society and how it's essential that we empower them to drive transformative change in our health systems. Next slide, please. In episode 4, Health Illiteracy and Vaccine Misinformation as Determinants for Equity, we looked closely at the strong impact that health and vaccine literacy has on vaccine equity and uptake. Our speakers highlighted that vaccine uptake can be reduced as a result of the spread of misinformation, hence resulting in vaccine inequity, and how engaging influential community leaders and community pharmacists can help us overcome this obstacle. Fiona Stanaway elaborated more on the WHO's 3 C's model of vaccine hesitancy: complacency, confidence, and convenience. She prioritizes building trust between policymakers and health systems and the public, as well as establishing convenient vaccination pathways in terms of time and place of vaccination, cultural context, language of communication, and other factors. This also includes making use of the convenient accessibility to pharmacists and community pharmacies to not only administer vaccines, but to also be a trusted source of information. In addition, our panelists discussed the importance of developing a collaborative, goal-oriented style of communication in which the health system is working with the people and not talking to the people. Next slide, please. Episode 5, Working Together Across Systems to Transform Vaccination Policy, revolved around how important it is to have intra and interprofessional collaboration to achieve equity. Suresh drew our attention to the significance of sharing data and technology among health systems and governments, as well as working towards equitable allocation of vaccines in which high and middle income countries support low income countries. Daphne and Metna highlighted how important it is to have the political will to transform vaccination and to involve all stakeholders in policymaking, which means empowering pharmacists to vaccinate, to join policy debates, and to raise their voice with other advocates, as well as utilizing the full skill set of a multidisciplinary health workforce in driving change. Next slide, please. Before we move on to recapping series 2, we would like to ask you which of those episodes in series 1 you've attended. To answer the question, you can either scan the barcode on the screen or go to www.menti.com and use the code on the screen 98589396. We'll give you a few seconds to answer.
Noor, I just want to ask Lina to stop sharing the slides, and therefore we can continue by sharing the results screen to see the answers that we've obtained. So again, thank you, colleagues, for sharing your answers. We just want to see which episode was the most prevalent among those who are here today. We'll give this a minute and then we can move to the next section, I think. Okay, I'm seeing episode 1, episode 2, and episodes 4 and 5. Okay. Other answers are being submitted.
Farah, I'm wondering whether, while waiting for the answers, I should introduce you as one of the key team members of this program. And of course, you'll be managing or facilitating the next section. So we could use that and then go back to the results. So I'm really pleased to introduce to you Farah, whom some of you already probably know. She's the FIP Regional Engagement and Project Coordinator at FIP, and she completed her Doctor of Pharmacy degree from the University of Jordan. She served as the President of Jordan Pharmaceutical Students Association, which is a member organization at IPSF, the International Pharmaceutical Students Federation. Farah is also the program coordinator of Transforming Vaccination, and together is part of the team with Noor and myself. Thank you so much, Farah, for everything you do. Are we getting some more responses?
Yes, we are. So we have six people attended episode number 5, 6 attendees for episodes 1 and 4. Some people attended episode 2 and episode 3. Yeah, we have a variety, Lina. I think we can stop sharing the results and we'll get back to the presentation now.
We have a Margaret saying she attended all of them. Margaret, thank you so much. And of course, this is an important point to remind you all that the recordings are available for free for all of these episodes and of series 2, as well as last year's episode. Everything is on transformingvaccination.fip.org. Farah, back to you.
Thank you, Lina. If we can just share these slides again. If we can go back, please, Noor. And again. Thank you. Thank you, Noor, and thank you, Lina, and thank you, colleagues, for joining today's summit again. And as mentioned by Lina, we planned a couple of engagement activities for everyone today, and we do invite you to participate in these with us. For the next, and before we go to the next engagement activity, I just want to mention that in series 2, it contains 7 digital events. We had regional roundtables, and we discussed and identified as priorities for sustainable access to vaccinations through pharmacies around the world. So today we will have our regional leaders. We've actually asked our regional leaders and our regional moderators to report some high-level outcomes emerging from these regional events and how we can reduce inequities and widen access to vaccination. So in each regional event, we focused on the regional needs and the regional drivers for transforming vaccinations. This involved identifying priorities in the region's countries with regards, again, to equity and access to vaccinations. We also discussed barriers and challenges and regional needs in relation to policy setting. So again, before we begin with the regional event summaries, we would like to have our second engagement activity with you. So today we have participants joining us from around the globe and from different regions, from different nations. So we'd like to know the region you are from. In the next slide, you'll see the QR code that you can scan. It's the same as the previous one, so please feel free to refresh the page or use the menti.com and the code 98589396. I think if we can stop sharing the slides, I'll share the results. We have 14 responses thus far. So the majority of today's attendees are from Europe. We have from the Western Pacific 4, It's good to see that we're covering all regions, and we do welcome all attendees from around the world. On behalf of the team, I just want to thank you for joining us, wherever you're watching us from, in today's global virtual summit. I'll stop sharing the screen. Please feel free to submit your answer as we go through the coming slides. Noor, if I can ask you to please adjust the slides preview. Thank you. Okay, so we will now proceed to hearing from our regional leaders. Again, to transform our regional perspective into a global perspective, we're bringing all of the key outcomes from the regional events into today's summit. And today we plan to give you a global snapshot, but we also invite you to watch the recordings and to go through the slides for each event. The recordings and the slides again are available on the webpage, transformingvaccination.org. And before I start, I just want to say thank you to all of the speakers who participated in the events, to all of the regional speakers for taking the time to share these key outcomes with us today. And for you, our attendees, we thank you for what you do to advance our pharmacy profession, and FIP is excited to collaborate and work with all regions, and our One FIP approach will assist us in doing so. So we will start our journey with the first region, the Americas. I just want to clarify that we had two events for the Americas region. The first event was on the 30th of September, which primarily focused on the priorities of countries in the North Americas. The event was delivered in English. And the second event for the Americas was on the 1st of October. It was delivered in Spanish, and it focused on the priorities of countries in South Americas. I'd like to welcome Eduardo Savio for the first event. Eduardo is the president of the Americas Pharmaceutical Forum, and Eduardo will walk us through some outcomes from the first event. Eduardo, over to you.
Thank you very much, Farah. I'm very pleased to be here today with you. I'm the president of the Pharmaceutical Forum of the Americas. Next, please. And I have co-moderated this activity with Carlos Lacaba, who is vice president of FIP. Yesterday, we have a webinar where this technical document was presented. That is a technical document that has an overview of the experience in the world, but mainly also focused in North American and Latin American. For us, it's the first document that has been altogether developed with the FIP, and it's available in Spanish, English, and Portuguese, which are the three official languages of our forum. We are very proud to have this for all the pharmacies of the region and in the world. And I think it is quite difficult for us to document what we are doing. And there is not such tradition in the Spanish region of the Americas. So we are happy to share this with you. Next, please. In terms of the barriers in this episode, we have as panelist Marta Rabur, who is from Shot Life, and she tips that the barrier to achieving vaccines equity are some of the ones that have already been mentioned today, but also reaching zero dose for children and the misinformations around vaccines were two of the five main barriers that were identified. The next, please. As a second speaker, Dr. Magali Rodriguez de Vidne, she's also performed as Vice President of the Pharmaceutical Forum of the Americas, and she's also member of the Executive Board of APHA, the American Pharmacists Associations. In the United States, you know, there has been a great campaign in support of vaccinations, but during her presentation also, she addresses the weaknesses and challenges regarding to vaccination equity, access, and sustainability. And in this dimension, the authority to vaccinate that has to overcome, in the case of USA, state authority, that there are still some restrictions. Also, another issue is the reimbursement for pharmacists to be paid for these services, the pharmacies to be identified as the frontline providers, and also that pharmacies has been identified as essential vaccines points to be trusted in immunizations. And one very important initiative is the neighborhood building with all the stakeholders, with the community, with other allies to provide and to amplify the provision of immunization. The next, please. The challenge and the lessons learned was also introduced by Casey Thompson. He is Chief Operating Officer from SHP, and he has identified several important issues. The last one is reaching rural and medical underserved community is a critical and key issue. There are some ways of performing health coverage that still not recognize pharmacy provide services, and vaccines trust and misinformation is one important issue that has been reported by several speakers during this webinar. And there are also, along the pandemic, changing information of what has been the group that can be vaccinated, and also this has been an issue of changing recommendations. Next, please. And finally, Sofia Segura, she's professor at the University of Costa Rica, and she also she's a very active collaborator of the College of Pharmacists in her country. And she has addresses all the different steps and in the different period where the pharmacists can give a relevant input, starting from research and development, where there are a few countries in the Latin American regions working in this area, and the step of approval of new vaccines in the vaccination centers, and after vaccination administered in pharmacovigilance, in the production, in the distribution and administration. Our technical documents has chapters where each of these issues has been developed with different experience. The next, please. And so finally, building vaccines confidence in the health neighborhood requires an interprofessional collaborations to increase vaccination rates. In this sense, the HP initiative has been very important, supporting Nurses Associations COVID Facts for Nurses campaigns. In the next, please. And also developing pharmacy workforce that has responded to COVID-19. We had learned that it's quite important in all the steps of the change. And not only started in vaccines development, but also paying great attention to distribution, paying great attention to vaccination, but also what happens afterward is monitoring and in surveillance. The next, please. Finally, what the conclusions of our webinar was that what do we need? We need to support pharmacist trainings in those countries where immunization services have not been implemented. We need to support advocacy where pharmacists are still not considered to perform vaccinations. But we need to strengthen pharmacovigilance systems to improve surveillance, and there are still great opportunities to improve distribution. The distribution is still a key issue that has to be paid attention. And only in 4 countries in our regions still are participating of vaccine development, which are a very few number. Next, please. Now I leave Dr. Carlos Lacaba, who is the FIP Vice President, and he will introduce the Spanish webinar. Thank you very much.
Thank you so much, Eduardo, for the comprehensive summary. And as you mentioned, to complete our picture about the Americas region, I would like to welcome Carlos da Cava. Carlos is Vice President at FIP. He's also a member of the Uruguayan Association of Chemistry and Pharmacy. Carlos, over to you to walk us through the outcomes of the second event.
Thank you, Farah. Hello, everybody. Good morning, good evening, good afternoon. In the second episode, which was developed in Spanish, we have 4 speakers: Dr. Magali Rodriguez de Bittner from United States of America, Dr. Mariela Méndez Ferreira from Uruguay, Dr. Sofía Segura Cano from Costa Rica, and Dr. César Moreno Romero from Colombia. The key issues that were concluded in this regional webinar were that despite there are no uniformity among the regions, there are quite a variation, but the vaccination coverage is quite high in all the Americas region. Not all countries have the same compulsory vaccines, and not in all countries pharmacies have the same responsibilities. Not immunization is not a work pharmacists do in all countries, but the participation of pharmacists is always present in some parts of the chain of vaccination. And in all the region, the vaccines are recognized as very important vehicles for public health. And this is a very important opportunity for us to improve our participation. Thank you.
Thank you so much again, Carlos and Eduardo, for providing an excellent breakdown of the Americas regional findings and for bringing these critical points to our knowledge. Let's move on to the next region, Europe. I'd like to warmly welcome Emma Paulino. Emma is the president of the Portuguese National Association of Pharmacies. She is the FIP Immediate Past Professional Secretary, and Emma will take us through the outcomes of the European event, which took place on October 14th. Over to you, Emma.
Thank you very much for the kind invitation and the opportunity to present on the outcomes of the European episode 2. As was already mentioned, this episode was dedicated to dive more deeply into what the needs, key priorities, challenges, and lessons emerging from the region with regards to widening access to the vaccination efforts. What we identified in terms of regional needs and priorities identified to transform vaccination is obviously that the using lessons learned from countries that already achieved transformation of their pharmacy services, namely in terms of implementing vaccination, is obviously helpful and can help drive change in other regions. Also, another priority that was identified as well as a need is fostering undergraduate and postgraduate education on vaccination across the entire European region. This was obviously identified as a need, but it's also a facilitator once the service has been negotiated with the government. And also the need to support the entire European region in the adoption of new vaccination models. And I will talk a little bit later about the importance of having a sustainable service through a remuneration system that supports pharmacists' role. In terms of the challenges experienced in transforming vaccination for pharmacists, there were some challenges that were conveyed by the participants, and we talked about the difficulty about turning pilot programs into nationally applied vaccination services, and also some regulatory obstacles that hamper policy change at the national level. Also, the need to receive support to drive forward changes at national level was identified, but it was also well acknowledged by participants, and also in terms of the country representatives from national organizations, that the work that has been developed by the International Pharmaceutical Federation in collaboration with all these partners has provided some useful tools that can be used both in terms of the policy and in terms of the advocacy for the service to be implemented in community pharmacies, supported by evidence in terms of the increased coverage of the population, but also in terms of the safety. So there are no safety concerns about enrolling patients for vaccination in community pharmacies due to the high competence of pharmacists, not only in the administration of vaccines, but also in terms of following up any adverse events that occur. And of course, also not only these policy documents, but practice transformation programs or documents that really describe what type of education, what type of transformation or adaptation in terms of infrastructures, what kind of educational needs are have been identified, and what kind of structured programs can we implement in order to advance pharmacists' competence in this level. Also, like I mentioned before, infrastructures, what kind of equipments, what kind of flows can we adapt in community pharmacies, and also, of course, how can we interact with other stakeholders to be able to well, not only identify, but also tackle some of the barriers in terms of perception and in terms of acceptance of this new service for pharmacists. And this can be done through communication efforts and establishing a collaborative environment with the other healthcare professionals. So what we have learned about transforming vaccination for pharmacists in Europe is that although sometimes it is difficult to transform or to scale up a pilot projects are a great opportunity to showcase the added value of involving pharmacists in the provision of vaccination services. We have seen this in a number of countries, such as France, and expanding vaccination services can also improve uptake. This increase in coverage in terms of the flu coverage, for instance, is a great case to involve pharmacists not only in flu vaccination, but now also in COVID vaccination and in other types of vaccines that can be administered in pharmacies. Obviously, and to finalize, we have identified some key vaccination-related legislative enablers and barriers that are particularly relevant for the European region. So we know that legislative changes are very much dependent on national factors. However, we know that success stories coming from different countries in Europe can be used then to advocate with our own governments to push vaccination forward. So it's about the need, but also about providing successful examples from countries within Europe so that countries feel more supported in order to advance the necessary legislative changes. We also concluded that patience and persistence are obviously important because legislative change does not occur well overnight. So it is important that we persevere. And it is also important that we can identify some champions, particularly in the medical field and at the policy making level, so that we can use those champions also to advocate on behalf of pharmacists, not only involving the pharmaceutical advocates, well, ourselves, but also in the evidence that we produce, but also have medical doctors and policymakers advocating for an increased role for pharmacists as well. Obviously, the COVID-19 pandemic and the fact that pharmacists have been involved in this effort is a beautiful and a successful showcase for increasing vaccination services from pharmacists, as we have exhibited throughout this process a high competency level. So to finalize, we also identified some next steps in terms of research and practice needs. So we believe that stakeholder consensus to allow policy changes is necessary. So we suggest and we promote that there are meetings for stakeholders that can then advance this advocacy effort. Creating platforms to share good practice and evidence, also to share patient experiences, and as I've mentioned before, establish sound remuneration models that provide sustainability for pharmacists' interventions. Thank you very much for the opportunity, and now back to Farah. Thank you very much.
Thank you very much, Emma, for your excellent overview and for bringing these important findings from the European region to our attention today. I think we can proceed to explore the next regional journey, and I would like to welcome Shirley Mailaniti. Shirley is FIP's Data and Intelligence Specialist. She's also FIP's account holder for the Southeast Asian region. Shirley will walk us through the next event. Over to you, Shirley, for some high-level outcomes.
Thank you, Farah, for giving me opportunities to share the key priorities, needs, and challenges and lessons emerging specific in Southeast Asia region to widening the access to vaccination. So during the event last month, apologize, Noor, can we go back to the previous slide? So yeah, during the event last month, we have speakers from Sri Lanka, India, Indonesia, and Nepal, as you can see in this slide. And we also have audiences from other countries within Southeast Asia region as well, such as Bangladesh and Thailand. So if we can go to the next slide, we will start now first to talk about what went well in the region and lessons that are shared by our speakers. So I summarize this into these following 5 points. So the first one is about the inclusion in the law. So this is observed, for example, in Nepal, where there is an established immunization act to regulate the equity access for vaccination across population. And the second point is about initiating local vaccine production, such as in Indonesia. And also adding to this point also, like for example, in India, India has exported vaccine for COVAX project to like 95 countries. So this is about how we can produce the vaccine locally. And the third point that I would like to highlight here is about the success of national immunization program, leading to high immunization coverage rate. For example, in Sri Lanka. So the success basically comes from the importance of having free healthcare services, vaccine free for all. So there will be no financial barriers to vaccines. And Sri Lanka also highlighted the strong primary healthcare system, focusing on community engagement and also empowerment of the community. And the fourth point that I would like to highlight here is basically the use of technology in vaccine distribution, such as India mentioned about the use of drones to transport vaccine to inaccessible area in India. So that can be another success lesson that we can share as well. And last but not least is about rapid responses. Particularly, this is related to COVID-19 in Sri Lanka, India, and Indonesia. And we highlight about the importance of the coordination across government and also across sectors, particularly for COVID-19. And if we can now move to the next slide, we will now talk about the challenges and needs that being discussed during the event. And I can summarize this more or less in these following 6 points. So the first one is about the geographical and also the demographical challenge. The uniqueness of Southeast Asia region, which is actually a home for over a quarter of the world population, This is very important because this highlights the challenge to access to vaccine, particularly related to equitable access across population, across priority groups, such as people with comorbidities, and also between the rich and between the poor. And in addition to that, there are also challenges to reach vaccination center because of the complicated geographical situation. So that's one of the challenges with specific for Southeast Asia region. And the second point is about the capacity in vaccine production. This particularly in countries with lack of funding. Although we also read from the previous slide that there are some countries also can produce the vaccine by themselves, but there are also other countries with lack of funding and don't have capacity for the vaccine production. And another point is about the limited infrastructure, and I think this has been mentioned also in another region previously as well. An example from the Southeast Asia region is about inadequate refrigeration for vaccine storage, the lack of laboratory testing facilities, which may affect the equity in vaccination. So it's about the limited infrastructure. And the fourth point is about limited human resources. Pharmacies have no direct role in vaccine administration, although this actually can be seen as opportunities for pharmacies. So pharmacies can be involved as a vaccinator, but also they can also be involved in adverse events monitoring, which also has been mentioned previously as well in other regions. Another challenge that we face in Southeast Asia region is about the public acceptance to vaccines, the resistance, and also about the misinformation. And this is also something that I think has been discussed as well previously in another region. We discussed during the events last time about the clarity, for example, for the need for booster dose vaccine for COVID-19. So that's another example. And last but not least is the improvement of health information system in some countries within the Southeast Asia region. Finally, in the next slide, you may see some key changes that we hope to improve as our needs and priorities for this region. We highlighted this as this following to achieve the goal, which is the equity and sustainability of vaccine. The first one is about the competency development. It is important. For example, an example that we highlight during the event is basically having a public health in pharmacy education for pharmacists to support their role in a health emergency. Also some skill set related to vaccination administration. Following the competency development, it is also important to advocate and recognize pharmacists as vaccinators to support with the equity access in vaccination. And the third point is about importance of data and knowledge sharing across countries, which I think have already mentioned as well previously in the other region. And we think this can speed up the vaccine transformation across our region. And last but not least, the word that you may see actually in across the three slides that I have here, which is about the strengthening the collaboration and coordination across sectors, across institutions within the countries, and absolutely across countries as well. So solidarity action is what Professor Boris mentioned in the beginning previously is also very important. So this is a brief summary from the Southeast Asia region, and I encourage you to listen to the recording to our event because actually there are a lot of lively discussion going on. And that's all basically from my side. Over back to you, Farah.
Thank you so much, Sherdy, for presenting this excellent and timely presentation from the Southeast Asian regional perspective. The next region is the Western Pacific. I would like to welcome John Jackson. John is the president of the Western Pacific Pharmaceutical Forum. He's also the president for the Pharmaceutical Society of Australia. John will walk us through the Western Pacific regional event, which took place on the 28th of October. John, over to you.
Thank you very much, Farah. It's a great pleasure to be speaking to everybody tonight for me, to whatever time of the day it is to you. Look, the Western Pacific region is incredibly diverse. Some of the largest, most populated countries and some of the smallest, least populated. Some with very advanced health systems and some that are struggling to develop the health systems. So it's not surprising that pharmacy services, and including the engagement of pharmacy in vaccination, is quite varied across the region. What I'd like to do in the next couple of slides is show you some of the matters that we discussed in the forum. And as I show you these slides, rather than go through this detail, because you've heard a lot of it from the other speakers, what I'll do is just highlight a few points that have arisen in the Western Pacific region. I'm very conscious of the time, so we'll push on. And the first one I'd like to talk to is about equity. On the next slide, thank you. There are a couple of points about equity that are worth noting. The first is that if we are going to have equitable access, there needs to be more touch points, and community pharmacy plays a very significant role here. But it's a case of how we get engaged as community pharmacists in vaccination. And the very first way is obviously through provision of information about vaccination and addressing issues such as vaccination hesitancy. And building on a reputation established there, we can then start to engage in actual administration of vaccination. The another point that I'd like to make here is that when a country is getting into vaccination, and there were some very useful lessons arising in our region in this matter, it was obviously sensible to start small and grow once again you've demonstrated your capability. So starting a program within a particular jurisdiction, a state in a country rather than the whole country, starting with one vaccine, and often it's an influenza vaccine, starting with an adult age group. And as we prove our capability there, expand into other age groups, other vaccines. The other point that I'd like to make in relation to, if we can move on to the next slide, please. And the next one. Thank you. The next point I wanted to make is in relation to interprofessional collaboration. And there were a couple of points here that were worth noting. The first is that pharmacists can be engaged in vaccination outside of pharmacies. And we have seen examples of that. And in the Philippines, the issue of the COVID pandemic led to pharmacists being trained and being engaged in vaccination workforces for COVID, but outside of pharmacy. And this has happened in a number of other countries as well. So this requires very significant interprofessional collaboration because you're working as a pharmacist in a setting other than a pharmacy with nurses, with doctors, with other vaccinators. But if we are talking about pharmacist vaccination in pharmacy, the lesson that came through our discussions was the need to ensure the record that is created of that vaccination is shared with, in an interprofessional collaborative manner, shared with the patient's primary health practitioners, their general medical practitioner. So there's some key points around interprofessional collaboration, working outside of pharmacy, but sharing the information that we have about our patients when we are working with them in pharmacy. And if we go to the last slide, I just want to touch on a few points in relation to regional priorities. And the key regional priorities came out, funding as the first one, needing to build either a taxation base or an insurance base, or perhaps even an employment benefit base for the funding of vaccination. Otherwise, it's going to be very difficult for pharmacy to get heavily involved in delivering vaccine if there's no funding process. The other thing is to recognise that we're talking about all of life vaccination. Most of the countries have some well-established childhood vaccination programs, and they've got childhood vaccination schedules. But many of our countries do not have vaccination schedules for older people, for middle-aged and for older people. So building that schedule of vaccination for those age groups is incredibly, incredibly important. And the final point I just wanted to make is the need for evidence and to share this information regionally, because there is no barrier nowadays to information, no national barrier to information. So building a sound evidence base for the value of and the role of pharmacists in vaccination can be shared across our borders and can help each other regionally. Thank you for listening. I'll leave it there for you. Thank you.
Thank you so much, John, for your detailed and extremely helpful overview. We're very pleased to learn about the Western Pacific's regional event outcomes. For our next region, please join me in welcoming Prosper Hayag. Prosper is the president of the African Pharmaceutical Forum, and Prosper will walk us through the next event where we explore a high-level summary from Africa. Prosper, over to you.
Thank you, Farah. I think from the last event, we learned three points, very important points, about the access, about the role of pharmacists, but also about the future of our continent related to vaccination. Let me tell you something at the beginning of the pandemic situation. Pharmacists went directly to the front line to produce hydroalcoholic solution, to promote barrier measures, and also to sell, to provide masks. But when it came to vaccination, when we realized that vaccination is necessary for all the world, we came to realize that there was no service of vaccination in our community pharmacies. Pharmacists were not involved in that. We realized also that 98, we depend on, all the continent depends on 98% of importations, which means that we don't have vaccine produced in our continent. We don't have sufficient medicines in our continent. That is why in this meeting, in the last meeting we had, we said we have to concentrate first in the education of pharmacists. We had to concentrate on legal aspects, advocacy to policymakers, because to recognize pharmacies, community pharmacies, as center of vaccination. This was important. Some few countries have done that. South Africa already had a law for promoting services, pharmacy service in community pharmacies, and they had good results. Algeria also, they made progress, Morocco and Egypt. When you see the situation of all the continents, we see that figures are from CDC, only 6.4% of the population is fully vaccinated, which means 2 doses of vaccination. It is very low, but how can we move ahead? First, we need to educate pharmacists more and more in our countries to join the program of vaccinations that is improved by the government. Secondly, we need to find a solution to produce vaccines in our continent. And at this moment, I want to highlight the initiative of African Union for the Vaccine Manufacturing Summit, which will take place in December in Rwanda. But it comes after a first summit, which took place in April. From April to now, there is some progress, remarkable progress which have been done. Egypt has signed 2 agreements with 2 companies to produce vaccines. Morocco also, Rwanda, Senegal, South Africa are on the way. All those countries are on the way to produce more for those who are already producing and to begin the production with some other partnership. Establish a vaccine industry in the continent is the best way to assure accessibility and equity. But we have also good news. One good news is coming from Nigeria, one of the biggest countries in our continent, that I want to read, which happened 3 days ago. A joint press release by Pharmaceutical Society of Nigeria, Association of Community Pharmacists of Nigeria, and the inclusion of community pharmacies as center of vaccination by the Federal Government of Nigeria. This is a very good news. This is a real progress to see the biggest country in our continent involving integrating pharmacies in pharmacy services. I would like to thank all my colleagues who participated to this event. I would like to thank all the participants from Africa to tell them that the fight must continue. Thank you very much.
Thank you so much for providing such an informative insight, Prosper. It was really interesting to hear about the African Regional Event Summary. We will now move on to the final region, the Eastern Mediterranean region, and I'll invite Lina to walk us through some high-level outcomes. Lina, floor is yours.
Thank you very much, Farah, for that, and thank you to all of my preceding guests who have shared excellent summaries. In the interest of time, I'm not going to share a full-on summary because we do have still the commitment to launch and we want to try and wrap up on time. But I would like to say and comment that a lot of the challenges and barriers that have already been mentioned also echo in the Eastern Mediterranean region. We've had a number of countries with us joining that reflect different situations and different economical levels and levels of crises as well. We have a wider issue of vaccine hesitancy, and legislative barriers are really key issues to widening access to vaccinations. But we will have a full summary in the collection coming out early 2022. So I'm going to reserve the summary for that so we can push on with the rest of the summit and try and wrap up on time. So moving on to the next slide, please. We are now pleased to finally be launching the FIP Commitment to Action on Accelerating Vaccination Equity, Access and Sustainability through Pharmacy. This commitment is based on the outcomes of the 2021 Transformation Programme. All of the outcomes of every single event of the 12 events has been sort of used, analysed and utilised to devise the statements that make up this commitment. So without further ado, I'll introduce my co-chair, Luis, to read us the commitment. Luis, the floor is yours. Thank you so much.
Thank you, Lina. So it's my honor and privilege to go through the commitment. So the FIP commits to transforming vaccination by accelerating vaccine equity, access, and sustainability, global and regional applicability. And the point number 1, supporting countries with accelerating policy development, implementation, and transformation through advocacy, guidelines, and support. Number 2, identifying the needs, priorities, and challenges of every region through needs-based policy development. Life course immunization. Point number 3, recognizing the impact of pharmacy-based vaccination delivery on disease prevention throughout life's ages and stages from childhood, including pregnancy, to late adulthood. Number 4, supporting countries to develop policies that enable pharmacies and pharmacists to deliver integrated vaccination services throughout the life course and as a part of wider national immunization policies. Gender. Number 5, recognizing the multifaceted impact of gender on vaccination access, delivery, and policy, and inequities in gender access to vaccines to inform pharmacy policy. Number 6, supporting countries to develop policies that accelerate equitable access of vaccinations to all genders, empower women as caregivers to support vaccinations, mitigate the impact of COVID-19 on gender inequity, and address the issues around gender inequity in the workforce, which is specifically important to discuss in 2021 year of the health worker. Health literacy, point number 7, recognizing the impact of health literacy and vaccine hesitancy on vaccines uptake and sustainable access, disease prevention, and overall health of the population, and integrating it in policy setting. Number 8, supporting countries develop policies that empower pharmacists to address health literacy and reduce vaccines hesitancy, disinformation in all parts of society by building trust through effective communication and easy access of correct and accurate information to patients and the public. And finally, working together, point number 9, recognizing and fully harnessing the power of interprofessional collaboration as a driver to achieving equity, accessibility, and sustainability in vaccination. And number 10, supporting countries to develop policies that allow for the sharing of data and technology around vaccination, as well as utilizing a multidisciplinary workforce to make vaccinations equitable, accessible, and sustainable. Thank you so much, Lina. The floor is yours.
Thank you, Luis, for that special reading. And we know it was a reading, but these 10 statements have been crafted and honed very carefully based on the few months that we've spent delivering this program. We're moving on quickly to a very quick engagement session. We'd like to ask a couple of our guests a quick question about implementing the commitment, but also want to hear from you in the meantime as well. So Farah, can I hand over to you to explain how can people submit their answers, and I'll go to asking our guest a couple of questions.
Thank you, Lina. So during the roundtable discussion, we will ask you to open the link that I just shared in the chat box, or you can scan the QR code on the screen. The question is, as Lina mentioned, which area of the commitment should FIP prioritize in an action plan, and what would be a helpful resource for you? Please keep in mind that this is a different link from our previous activities. It will take you to an online collaborative note-taking live tool. We will stop sharing the slides now, and I will start sharing the screen to quickly go through it with you. So you can click here to go to the link, to go to the commitment and to read the commitment. And you can click on the like button to choose the area of commitment that you believe FIP should prioritize in action, whether it's gender, global and regional applicability, health literacy, life course immunization, or working together, and add your comments to provide more details under each part by pressing on add comments. We'll keep this going as we have a roundtable discussion, and live responses will be displayed on the screen. If you wish to leave your comments in the chat box, please do that. We will gladly copy and paste it in the Padlet link. And if you need any help, please do let me know using the chat box. Over to you, Lina, to start the roundtable discussion.
Thank you, Farah. We'll keep this in the background for a couple of minutes as I speak to Jane and Bettina. Please submit your answers. We will be using your input in further work and possibly in the collection. So your participation will be really helpful in implementing the commitment. We promise that. So maybe I'll ask Jane and Bettina to come on camera for a couple of minutes, and we really thank them for staying with us today. We understand how busy their schedules are. And especially as leaders of other civil society organizations, we'd like their advice on how can FIP, with the support of pharmacists, with that cohesion and solidarity of the workforce, how can we turn this commitment to action into an actual action plan? We love the words on paper, they're good statements, but we want to actually do something about that. So what advice do you have for us? Maybe starting with Jane.
And thank you very much, Lena. It's a complicated question that can't be answered in a couple of minutes. So I think first and foremost, we can't do it by itself. So cross-sector and cross-discipline partnerships are going to be critical. Everything happens at a local level. So plans actually have to be developed locally and take into consideration the cultural influences, but also the political investment and the financial investment. So culture, gender, the environment. So if I'm touching on working together, That's the medium through which we work. Life course approach is the overarching agenda, and we have to look at it from a local, national, international perspective. And I would see that health literacy and gender, are lenses through which we need to be addressing the barriers, of which there are many. So I'll stop there, Lena, and hand it over to Bettina.
Thank you, Jane. There may be a follow-up interview coming your way, so that's a warning. But thank you for that brief answer to a complicated question, and I do appreciate that. It's not a very straightforward one. Bettina, we'd love to hear from you.
Yeah, again, difficult, but as we say in public health, we are all very good in data and analysis and statement, but we are weak in implementation. So if I think especially about you and about us, Jane and others, as civil society organizations, I really would underline, besides collaboration among ourselves, the role of civil society. And I think that pharmacists have a great possibility, because the society at its complete diversity walks into your pharmacies every day. I think that a pharmacist has more contact to the broad variety of civil society in its region than, let's say, the gastroenterologist or the whatever other healthcare specialist. So I also heard during today's session about barriers. And we should never forget, barriers are man-made, men/women-made, mainly man-made. And that is our role to move them. And how do they move them? I think as you have a good contact to your direct civil society, and this is still quite healthy, because in our so-called healthcare systems, we mainly take care of diseases and do disease management, whereas you do meet a lot of still quite healthy persons with some problem. So you can directly come into contact, start the discussion, as we said also about vaccination hesitancy, and then start to move things forward. I think that moving barriers together with those concerned is the most efficient way. And the ones who come into your pharmacy are concerned with your work. That's why they come in. Don't forget that, for example, at the beginning of the AIDS pandemic, it were the concerned people who moved everything, who moved research, who moved production of vaccines, who moved IP on vaccines. They were the ones. So as you have a great contact to people concerned with our work, your work, I would first of all use this way. And for sure, as Jane said, the collaboration with other people in your sector, locally, nationally, and internationally. Thank you. Back to you.
Thank you very much, Bettina, for that. And I'd like to thank you, Jane and Bettina, both for supporting us throughout the program, especially you, Jane, and today at the summit. We're really, really grateful for that. Thank you so much. And thanks for those submitting their answers. We see a lot of hands up for global and regional applicability, health literacy, working together. Really, all areas are important in every single way. Finally, before we finally close the session, I'd like to invite my colleague Gonzalo to share with you all the latest resources and tools we have that can support you widening access to vaccinations through pharmacy. Gonzalo, the floor is yours, and a few minutes for you.
Hello, everyone. Just very briefly, thank you very much for the opportunity to present some of the resources that FIP has recently developed throughout 2021, in addition to the collection from the Transforming Vaccination Program that Lena has already and the team have already presented. Just a couple of other publications and resources you may use as part of this work. Next slide, please. Starting with this publication that we recently launched to support pharmacists and pharmacy organizations around the world in addressing vaccine hesitancy and complacency, and really helping to build confidence in vaccines in our communities. The next slide, please. So this publication addresses the various types of positions or opinions that people may have around vaccines, and because vaccine hesitancy really exists on a continuum from full acceptance to full rejection. So we need to understand what are the reasons and tackle them individually. And this includes also leads to the second part of this publication that provides guidance on approaches to tackling individual aspects of vaccine hesitancy through behavioral science and tips on how to address this at the individual level. And then also a series of campaigns that have been led by pharmacy organizations or targeting the pharmacy, community pharmacy channel, let's say. And these are more mass communication strategies to communicate vaccine value and confidence, and to support and encourage people to get vaccinated and to consult with their pharmacists. And finally, there's vaccine information for pharmacists about the tips and safety information and potential side effects that may be provided by pharmacists to the community. We had a question in the question box just a few minutes ago on resources that could be used, so this is definitely one of them. Next slide, please. Another resource is the vaccination handbook for pharmacists. This includes a description. It's a handbook, really, so it's a very practical, hands-on information publication for pharmacists that covers the procedures, safety aspects, also common risk points that pharmacists may need to consider when delivering vaccination services to the community, and includes a series of frequently asked questions as well. Publication is also available in Spanish. Next slide, please. So you will see that this publication covers different roles that pharmacists can play, not only in the administration of vaccines, but also in community education, advocacy, and promotion of vaccination, also vaccine logistics, but also in keeping vaccination records and facilitation vaccination appointments. So all these are roles that may are prior to the administration of vaccines that may require a specific regulation, but these can be done in any country, really. And then the requirements for vaccine administration and also the procedures themselves to dealing the safety aspects, the risk points for the administration of vaccines, and also dealing with potential adverse reactions and anaphylaxis, for example. Next slide. We also launched the pharmacy-based pandemic vaccination program regulatory self-assessment tool, which really helps pharmacy regulators in developing legislation that or in reviewing their legislation in order to introduce regulation of pharmacy-based vaccination services. Next. Thank you, and apologies for the brevity, but we're really, for the sake of time, I'm going pretty fast. And very recently, we launched a prevention microsite of FIP, where we compile all these publications and resources, not only in the areas of vaccination, but also vector-borne diseases and self-care. And for the sake of time, I will leave it here. I invite you to visit the microsite and to get to know all the resources that are available there. Thank you very much. Back to you, Lina. Thank you.
Thank you so much for that, Gonzo, and apologies for rushing you. But the prevention website has all of the resources. I see a lot of questions asking for the lists of resources that Gonzalo has just mentioned, so you can find them online by visiting the new prevention microsite. We will be closing the session. Just quick acknowledgements. If we can go to the next slide, we cannot not acknowledge everyone who has really supported us. Thank you to all of our esteemed moderators throughout the 2021 program, some of which were with us today. Thank you so much to our speakers as well from all around the world. We couldn't have delivered this program without your expertise. And special thanks also to our supporter, Pfizer, for the unrestricted grant, and special thanks to Diane Thompson and Mary Yankonas as well. Thank you. Finally, also acknowledging our leadership members and partners, our president, FIP Executive Committee Bureau, all our members and partners who have delivered or co-delivered parts of this, especially the regional pharmaceutical forums. We have honestly could not have delivered this program without you. Special thanks to everybody who is part of the program team at the headquarters. Thank you, everybody, very much. And thank you as well to the events and marketing team for helping us deliver the events from a technical point of view, but also market and communicate the full program. Thank you so much. And to everybody else at headquarters who have inputted in one way or another to the success of this program. I'd also, maybe moving on to the next slide, before finally closing, I'd like to thank Luis. Thank you so much, Luis, for co-chairing with us today. And it's a real pleasure to have you with us at FIP.
The pleasure is all mine. Thank you so much, Lina.
Thank you. If you aren't already, please consider being a member of FIP. We have summarized the benefits here for you. Visit our website for more information. And for more events, the next slide shows you the URL where you can find our full calendar of future events, but also the past archive of all the events we have delivered in 2021 and beyond. Thank you again once more, and wishing you the best wherever you are. Thank you so much.
Bye.
Bye.
Thank you, everybody.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Thank you, everyone. Bye.
Bye.